Welcome to today's Talk Business and Politics Daily. I'm Roby Bright, joined by Marcy Doderer. She's the CEO of Arkansas Children's. Good to have you with us.
Good to be here.
I left hospital off. Are you proud of me?
I'm proud of you. You've got it right this time. I like
because
that.
we got hospital, we got foundation, we got research, right?
Yep.
See,
We're
maybe
going
not in
across
that
the
order.
state.
That's good. Good to have you back.
Hospital Research Foundation.
I know. I got them in the wrong order there, but I'll stand corrected on that. Let's begin with... let's talk about what's going on campaign season-wise right now. We have a lot of conversations about healthcare going on in this state as well as this country. A definitive issue in some of these healthcare conversations is pre-existing conditions.
Right.
Where do we stand with pre-existing conditions when you look at what is happening in that national debate, and are you concerned about that?
Maintaining a protection for children in particular against exclusion from health insurance because of a previous or pre-existing condition is of utmost importance to those of us who represent child health. And our kids, our families, people are protected today under the Affordable Care Act from a pre-existing condition being held against them in future enrollment of insurance product. And we would like that to maintain an absolute right of the people of the United States, a rule that we can enforce. A children's hospital sees, in any given state, we only touch about 15% of all children. Most children don't ever need us, but the kids who need us are the ones that will be impacted by such a rule change or policy change. If you're born with a congenital anomaly, if you suffer from childhood cancer, if you have a severe automobile accident and have recurring and complex and chronic illness because of that, those all start to form a pre-existing condition and become very worrisome to families as a parent moves jobs and gets a new health insurance product. As the child ages and goes through college and is on their own, they enter their own workforce and they have to enroll in their own health plan, what that will be. So it is a very real issue for millions of Americans, and is something that the Affordable Care Act helped protect us against any future damage to that individual, and we would love to maintain that. It's also near and dear to my heart personally because of my own child's experience.
Sure.
So.
Which you've shared with us before. So, and how's she doing?
She's doing great. She's
Good.
A junior in college and doing really well.
Awesome.
Thank you.
So, obviously, I'm not going to ask you to make a political prediction. I'm not asking you to take a stand or a side on anything here, but will the debate be different depending on who is in control of Congress after this election cycle?
It does. The debate for child health policy does usually change. Now, we've gotten, in certain aspects of child health policy, bipartisan support. Right now, for example, we're helping move a proposal through the House in D.C. called the ACE Kids Act, and it's accelerating care for exceptional kids. It carves out the sickest of the sick Medicaid children across our country and tries to create a better system of care to coordinate their care and lower the cost. So just this week, that bill in the House has been scored by the CBO. I haven't seen that data yet, but assuming the score, it had to get scored to be entertained by the full House. It moved through the committee structure last month. And we're hoping that the score is such that it'll be taken up on the floor of the House after the election season. It would, and we've had bipartisan support for that. But each of these programs that we talk about for child health, when we bring them forward, whether it's a Medicaid program, a CHIP program, something to do with maternal and infant child health, there becomes a partisan debate at times, and we try to help any party in power understand the importance of caring for kids and the importance of health policies that supports the next generation of Americans. But the debate gets harder depending on who's in office. So.
Yeah. All right, so let's leave it there and turn our attention to what you've got going on internally here. You do have a new child health initiative that has been underway that you have been talking about more. Tell me what is at the core of what you're trying to do. It goes beyond just providing clinical services to children in health.
So our expressly stated vision statement right now is to fundamentally transform healthcare delivery for kids. And so that really means bricks and mortar, sites of care where we impact clinically with the kids across our state. And what we've realized is even as we've done that, and we've done that well, and we're taking care of more kids and we're closer to where they live, we have not necessarily changed the outcomes of health for the state of Arkansas when it comes to child health and well-being. And we'd really like to be impactful at having Arkansas be a safer, healthier place to be a child. So we're expanding our vision. It's really kind of a dual vision of sorts, healthcare delivery, but we also now want to fundamentally transform health. And so there's a few kind of strategies we're starting to explore. Nothing shaped up into a document yet, but looking at things like food security versus dwelling on food insecurity. 25% of the kids who show up in our ER don't know where their next meal is coming from. How can we shape that? We have an epidemic of child abuse in our state, 11,000 plus reported cases of child abuse every year. Think about that against only 710,000 kids. So how do we move to child abuse prevention plans?
These are things that you can't do within your clinical setting, but these are things you have to partner with people
Absolutely.
and get out into a community and try to work for some policy changes as well as just some attitudinal changes. Am I reading you right?
Absolutely. So what we say is we should be the convener. We can be the aggregator. We can host the conversation. So if you think about one health statistic in Arkansas that's really scary is infant mortality. Infant mortality is defined as when a baby dies within their first year of life. Arkansas as a whole has an infant mortality rate equal to the country of Lebanon, a country that's been in political strife for decades. Mm-hmm. Some of our counties in Arkansas have an infant mortality rate equal to infant mortality in Libya, a war-torn North African country. That's scary. So we're looking at how do we help deliver better care to pregnant moms at delivery and the newborn in those immediate days of life. We don't deliver babies at Arkansas Children's. We take care of the sickest of the sick when they arrive on our doorstep. So we formed a newborn nursery alliance. We have 5 community hospitals in there right now. We're hoping we have a 6th coming close to signing. Our goal is to build a network of services of community hospitals who deliver babies, who want to keep those babies with mom when they're not so well and can't go home right away. And we're leveraging that brain power in a way that is already starting to change the outcome of kids across the state. In Crossett, Arkansas, in Hot Springs, in Pine Bluff, and in Little Rock, it's a all teach, all learn process. So it's not this assumption that Arkansas Children's is the big city people when we know it all. We're actually learning from Hot Springs and taking best practices in their newborn nursery and spreading it across the 6. And that's our intent on that, so that over time, we can really influence infant mortality. So it is really a partnering approach. It's an alliance. It's not Arkansas Children's being in control and dictating with our, putting our thumb on the heads of other providers across the state.
It's more of a collaboration there in an effort. So talk to me about another initiative that you guys have launched, and it involves Walmart and Legal Aid of Arkansas. Don't think that people would be thinking out of the gate that children's health is dependent upon having good legal representation.
Absolutely. You don't think about that when you arrive for care. But I'll talk just a minute about something called social determinants of health. It's kind of a fancy phrase. It gets thrown around a fair amount in healthcare these days. But essentially what it says is that only 20% of your health is defined by clinical care. Only 20% of my overall health is defined by clinical care. Environment, food, exercise, social networks, all of those things combine to say, how healthy is Marcy going to be? How healthy is Roby going to be? And the same is true of any person. And right now, unfortunately, we believe zip code actually determines health considerably more than genetic code, and for kids. So when families arrive at our hospital for care, we first and foremost take care of them from a clinical standpoint. But we've gotten really good at trying to understand what else is going on in the life of that family or that child that is going to impact the overall health of the child. And for families who are at a lower socioeconomic level or just don't have an education or an understanding of a legal system, and they need help working with a landlord to ensure that the home is actually, or the apartment is actually clean and safe for an asthmatic child. Or they need help fighting an insurance issue when the insurance company isn't wishing to pay for something, but it is covered, it's a covered benefit. We want to connect that family with a legal source that can help them. Walmart in Arkansas, with the corporate headquarters, they have more corporate attorneys at Walmart than any single law firm in our state. And so they have the ability to leverage that talent and time to help families. And so it's called a medical legal partnership. It's not unique in Arkansas. I actually worked with one in San Antonio, and Walmart helps establish medical legal partnerships in other states across the country. And then we bring in Arkansas Legal Aid, pro bono legal services, so that we can connect a family with a lawyer, understand their issue, and have that lawyer partner with the family to address the housing issue, the school issue, the insurance issue. Probably 1,000 families impacted in the last year.
Wow.
And real things. So one great story, a young child born with considerable congenital anomalies, unable to walk, no real arms, needs a wheelchair to mobilize, right? Well, the government-funded program that was insuring this child didn't believe that paying for a motorized wheelchair was a good use of their resources because they didn't think the child would ever use it. So with the help of our legal aid services and the medical legal partnership, they actually got one of those wheelchairs, taught the child to use it, videoed the child using it, and sent that to the payer to say, you really need to pay for one of these wheelchairs. This child can use it, and you will change the life of the child. And it worked.
Oh, that's a great story. Last question for you. I've been hearing internally, you have been talking about some changes that you want to make at Children's Hospital, particularly for your workforce over there. Care to spill the beans?
Absolutely. So it's, in some circles, probably considered controversial. I think it is a testament to the board of directors of the Arkansas Children's System and the importance they placed on having a strong, vibrant workforce. We employ about 4,300 individuals right now, and that workforce is growing. When we think about our obligation to the people who work for us, who are part of our team, one of those things we want to provide them is a living wage. When I came to Arkansas Children's 5 years ago, our minimum wage at Arkansas Children's was just over $8 an hour. It's currently at $10.10. So any entry-level workforce, the minimum pay is $10.10 an hour. On January 1, we're moving to $14 an hour. It's part of our budget. It was endorsed by the board. We believe it helps create a living wage, not dissimilar to retailers, what they've done across the country, moving to $15. We're not taking that step. It's our ultimate long-term goal that we will move to minimum wage of $14 an hour so that our employees feel like their paycheck can take care of them and their families.
All right, good stuff.
We're
Marcy
excited
Doderer.
about that.
Yeah, you should be. CEO of Arkansas Children's, thank you so much for being here. Always good to visit with you.
Great to be here. Thanks for letting us tell our story.
You bet.
Appreciate it.
That's all for today's program. Thank you for tuning in. I'm Roby Brock. We'll see you next time.